PPE. It's an acronym you've likely heard a lot of in the past few weeks, particularly in terms of shortages for medical professionals. PPE stands for personal protective equipment, and it's one part of stopping the spread of COVID-19 and keeping healthcare workers such as doctors, nurses, and other caregivers, as well as emergency personnel, firemen, policemen, on the front lines of the pandemics, keeping them safe. The equipment's necessary for both public and personal health, but there's a glaring problem in the US right now, and that's a shortage of this personal protective equipment. And it's putting anyone who comes in contact with COVID-19 patients at risk. PPE as a category includes really consumable items, gloves, medical masks, respirators like the N95, we've heard a lot of that, eye protection gowns, aprons, and boots. This equipment is in short supply because of misinformation, panic buying, and stockpiling. And these medical professionals need this because they're in such close contact with those who are patients or potential patients. And most of this PPE is single-use items. To help us combat this shortage and to direct supplies to those in need, Oracle's developed a crisis supply exchange for capturing those contributions and requests and matching them together. Our platform uses fuzzy text searching and directed search using really key attributes such as equipment type, make, model, manufacturer. Requests can be made for donations, trades, or even industry for sale items. This equipment's really needed. We're identifying different ways in which people can access and identify their particular needs. Claims are made against available supply, and both parties are connected through this exchange platform anonymously until those parties need to make that connection in order to make that exchange of items. Another part of this crisis is actually the medical personnel. The crisis supply exchange also allows us to identify people with desirable and needed medical skills that may have been moved out of a facility due to COVID-19, and they may be needed somewhere else. Maybe it's at a long-term care or an elder care facility, or maybe it's at another clinic for helping on the front lines of this disease. Oracle's doing its part, providing this platform, providing a way for us to exchange and identify those in need and those who have supplies of medical equipment, as well as labor needed. It's one more piece in that puzzle to help our healthcare workers and keeping our community safe.